Hello, good morning. Sorry, I welcome Dr. Geeta Patil, respected Geeta Patil Madam, all esteemed people here. Geeta Patil Madam, teacher is here. Dr. Rawat sir, he was our guide and everything. Welcome you, Patil, all esteemed delegate. It's my pleasure, Madam, to chair your session. As you all know, she is a senior consultant pediatrician, adolescent health specialist, and counselor at Chaitanya Hospital, Bangalore. She was the president of IIP Bangalore in 2017. She was joint organizing secretary of National Pedicon, which was held in 2017. She was the chief organizing chairperson of National Adolescent Bangalore 2019. She was the organizing secretary of South Zone Pedicon. She was the CIP of EB member in 2020 to 22. She was the Central AHA chairperson now to 24 with Dr. Lignesh Yalkar and Dinesh Rao as the secretary president. She is a FIP awardee to 2021. She has more than 22 publications. Give big round of applause to Madam. She is a it's a long list is there. She is a national advisor for IIP, editor of IIP AHA textbook. She is a faculty in local, state, national IIP Special Action Plan. Madam, you are trainer for NCECD, NTEP, WAR, Fever, NEP and whatnot. We are really privileged to have you. She has got special interest in adolescent medicine and nutrition. So over to Madam Patil, Madam, please.
Thank you very much, Bodhankar sir, for your kind words. I think just now we have heard Dr. Sanjeev Marathe sir talking about the preventive vaccine. So now I am going to talk something like that, but in a different concept. Definitely, how much interest people have got in this, because vaccine talk is like a hot talk. Whole hall will be occupied and people will go on asking the questions. I expect same thing for this also talk, because it is essentially required for all of us to know about this. And there are many experts in our audience. I think Shubha Madam I am seeing here. If any question comes, she can answer because she knows better than me. I think I can confess that I have not done a special study, but we have attended some workshop because I belong to Bangalore. So Nimans, it is very freely, many things are available, and I want to make it more simplified, because many of them feel the moment we utter mental health disorder, definitely tend to refer. So let us not do that. Why that? I am going to talk now. So the topic is empower the adolescents. See, it's a great thing that theme of Nagpur AHA is this year, empower adolescents to unlock their potential. It's a great thing. Because of that you can achieve a physical and mental health. And my talk is something connected to that only. See, by proper doing mental status examination or mental health assessment, we can diagnose certain things little early and we can intervene early. Definitely vaccines are very important for us. Apart from that, this is the topic which everyone should now take it as a interesting topic and should work for that. So next 20-25 minutes I am going to discuss all the points which I have mentioned in this slide in a little simplified manner. I am not going to talk something in a lot of technical way so that people lose the interest. So obviously the importance of mental health, its incidence, what is the basis of psychopathology, current barriers, what are the risk protective factors, red flag signs, common mental health problems, mental status examination, and common mental health screening tools. I am very sure even if you are adolescent specialists, I have seen many of them don't tackle these things because this is little time consuming than other cases. And definitely mental health matters. And let me confess, I have taken a lot of references from RKSK handbook, and somebody told we have release of our IIP AHA textbook of adolescent medicine, and the section on the mental health disorder, the section editors are Dr. Sushma Desai and Swati Ghate. I thank, and they have presented in our workshop also in our Pedicon. So many references with their permission I added in this. So when we say mental well-being, we should know what is mental well-being. Physical well-being we know. So why not know the mental well-being? That is a general definition for everyone. That is enables the people to cope the stress of life. We understand. realize their abilities, and then learn well, work well, and contribute to their community. This is a mental well-being, and I am very sure right from childhood to the old age, all of us crave for mental well-being. And it is very important, we have understood after COVID. So mental disorder is a syndrome characterized by clinically significant disturbance in individual's cognition. I am simplifying, emotional regulation or behavior that will develop dysfunction in the psychological, biological or developmental process. This is very important thing. It is described as a syndrome. So we have to know about that. So I think we, as a nation, we have done a lot of progress. Now we are reached to HPV vaccine given on the government setup. So we are trying to control a lot of physical health problem, nutrition, infectious diseases, reducing under 5 mortality. I am very sure there are some seniors here, our OPD, how are the patients we are getting it now, we know. Infectious diseases, obviously, diarrhea, pneumonia, definitely reduced, government has taken care. First 6 months, most of the vaccines are getting covered in government. But is it mental health care has been given that much attention? Still not. So we need to know about that. So adolescents are very prone for mental health disorder. As such, anyone is prone, depending on the things, because of their neurodevelopment. Everybody knows that prefrontal cortex is last to mature. So they are impulsive, their executive functions are affected. We welcome our President-elect Dr. Vasant Kalatkar sir. He came. Sorry sir, we started before you. So neurodevelopment plays a major role here because they're very impulsive, and then exaggerated response to stress is there, peer pressure is there, influence of media, and lack of access to adolescent-friendly health services. I am very sure no adolescent will like to go to a place where door is open because COVID is there, no door is closed, there is a lot of noise going on. So this is very important for us to know. So it is a responsibility of our healthcare system to suffice both physical and mental health needs. Now this is a simple thing I am telling, mental health continuum. So one end it is a distress, one end it is wellness, and in between there is a problem. So anybody, this is a range from mental wellness to mental illness, and depending on the personality or genetic character, and apart from that the environment, the circumstances, you may be on the illness side, unwell side, but you can go to the well if the environment changes, you develop a life skill. So we play a major role here. So this is very important for us to know, because 50% of adolescent mental health disorders can become preventable if we understand this mental health continuum. That may not happen in the physical health that commonly. So many people we say, oh, I am very stressed, that is not a mental health disorder. Then socially deviant behavior, political, religious or sexual. This is mainly the conflict between the individual and society, but that is not a mental disorder. Why we are focusing so much on mental health disorder and why I am emphasizing? Definitely the prevalence is high, which I am going to talk in the next slide. Early detection and management, like any other disease, early management, early diagnosis management is very important to have a better life in the future, as well as reduce the expenses. Tremendous expenses are there. And we have learned a lesson after COVID-19. There are a lot of psychosocial problems happen. So globally, 1 out of 5 adolescents may experience mental health conditions. Mental health accounts for 16% return, maybe usually all the data shows 13%. Maybe this is a global burden, and in India they say 7.3%, but if you add substance abuse also in that, it is more. So it is as good as many other infectious diseases for which we are taking so much efforts. So 50% of mental health disorders manifest by the age of 14 years, and mental health concerns are almost in the rural area 28%, urban area 17%, and imagine metros it is 55%. These are all RKSK slides are available everywhere. Now it is a freely available. Already I have discussed about the prevalence. Why I am talking about the prevalence? Not the numbers. The importance is it is as high as many other physical health problems. So we need to know that. And the distribution is among the boys and girls is equal. So there is a WHO has told that prevalence of depression and anxiety in Indian school, it is 25% and 8% respectively, but mainly the schools were from metros. 11% used drugs, 7% were bullied, 10% had no friends and 8% were lonely. Only 62% felt that their parents were able to understand their worries and problems. It's quite a big problem for us. And definitely there are barriers in the delivery of mental health services. First and foremost, lack of adequate and appropriate information about the mental health. And underreporting is common. There are myths and misinformation about these medications that causes addiction, that causes drowsiness, that causes obesity, and many more. And this is considered as a stigma to accept as a mental health disorder. And regionally, it is accepted in a different way. And definitely mental health concerns, there is no priority given. Even our budget doesn't mention about mental health disorders. And we are having IIP president-elect here, so I think he can take care that mental health care has to be given in an action plan, sir. So maybe this is a suggestion. How many people attend, I don't know, but this is essentially required. The number of, so mental health care professional to serve the required population is very low, sir. So compared to the burden of mental illness, so it is our responsibility to get trained. We may not be specialists like a psychiatrist or psychologist. You don't need to do a different course for that. But develop a sensitive ears and mind at least for that. So that they can have a fulfilling life later. Now I am going to give one simple case. I think everybody gets this. A cough, cold, fever, cough, cold, 13 years old boy comes to our place. He is academically good. No complaint about the behavior. But when you look at him, his face shows there are no facial hair. 13 years, I think there are experts, what should be the sexual maturity rating, maybe 2 or 3. So his height is below average for age but matching with mid-parental height. Is it worth doing mental assessment here? Can you tell, how do we assess? Do you feel that mental assessment should be done? Why?
I think we may be bullied for it.
Yes, sir. I think I should not, somebody else should answer. So, these are the soft signs to do mental assessment. So, every case you have to be very vigilant. So, there is certain thing is there that we have to see. So, we should not ask them a close-ended question. Ask him how many boys in your class are taller or shorter than you. Do you want to be tall? Do you know how to be tall? He may be a late bloomer. Constitutional delay in puberty and growth. But please remember these things we can detect. So what are the common mental health disorders during adolescence? I am not going to detail technical things, just a broad classification as RKSK has given these slides which can be understood by MBBS doctors also. So I request everyone to go through that module. It has come and everything is mentioned in that. And they say the childhood mental disorders like ADHD, conduct disorder, learning disorders. Conduct disorders because we are little confused. Adolescents are always rebellious. They always try to oppose. Is it a conduct disorder? No, there are some guidelines which we have to follow. So no, many times parents come and tell because they are half baked. I am practicing in metro that this fellow has got a conduct disorder. That doesn't fit in the conduct disorder. See, some of them go through and they talk. Emotional, or maybe teachers refer to us telling that this boy or girl is having a conduct disorder, not at all. Anxiety, depression, suicide and self-harm is very important. Eating disorder, anorexia, bulimia is a topic on its own. Risk-taking behavior, substance abuse, perpetration of violence is very important. So we should know how to diagnose it. So serious mental disorders we are not going to definitely treat, but at least we can suspect and refer. So these are the schizophrenia and bipolar disorder. Not going into detail of all psychiatric problems. If they have got a false belief, hallucination, psychosis, delusions, impaired judgment, always suspect, because there are some people I think we go on doing counseling, that does not help, and here the medico legal problem comes. Please, all of us have to remember, we are not supposed to meddle here for a long time. Immediately refer. So now infectious disease, we are all infectious disease specialists because that is our bread and butter. So here we always consider host, environment and pathogen. What is here in mental health disorder? The host is the individual. Socio-economic influences is the environment. Stressors in the life of an adolescent is a pathogen. So consider that, and it is a complex in nature. Multiple determinants have got impact on the severity, manifestation and prognosis of the mental illness. So psychopathology is a simple word I have described. We say no psychopathology, we don't say no mental, we say psychopathology. This is the basis of psychopathology. And how do they present to us? We have to be very vigilant. They may be having a psychosomatic problems like a sleep problem, eating problem, dizziness, sweating, generalized aches and pains, decreasing academic performance. That is the commonest problem for which adolescents are brought to us, and we go on diagnosing different things. And high risk behaviors. Some of them are sad, anxious, mood swings, loss of motivation, social withdrawal or reduced participation. So we should know what are the red flag signs. I have not done for separate condition like anxiety, depression, substance abuse. I am mixed up because enough data is available everywhere. Just I want to everybody to sensitize when they come to us, at least see these red flag signs. Important in substance abuse, very important. They try to avoid the parent. They spend more time in the toilet. They have got a new set of friends. See, all these things are there, and they have got an injection mark. There are many things are there by which we can diagnose. So obviously protective factors are very important. Important is intellectual development. See, you know ADHD is very prone for substance abuse because of their nature. High self-esteem, good emotional support, family connection, school connection, positive peer pressure, positive role models. All these things are very important, and definitely we should know about the risk factors when they come to us, because they may be on individual level, family level, school factors, community factors. All of you are aware about these factors. I am not going to go into detail. Now I am going to come to a second case. It is a 15 years old girl brought to us telling that, and parents are successful doctors. I think it may be one of us also. Bring her with the concerns of falling grades. School directed that she has to have a evaluated by professional. She was not interested in school drama, neither she was interested to talk her friend, or she was not happy with her younger brother also, and she was spending lot of time in her room. Parents were not able to spend time with her because of their profession, and they had lot of expectations from her. This is a common complaint we see. So medical history was normal, general systemic examination was normal. Only one thing was investigation, hemoglobin was 10.5. Common in the now Anemia Mukta Bharat, 13 February is the World Anemia Day. So this is a mild anemia also. Thyroid functions were normal. Heads gave us lot of information, and obviously we could diagnose that she had a depression. See, Beck's inventory, I think that also I am going to come little later. That score was mentioned there. I don't know whether it is there in this case. So no, it was some 25 or something. Moderate depression was there. Heads gave us, heads all of you know, psychosocial screening. That we always ask. Then mental status assessment done. She was sad, good eye contact, all these things were there. And I am going to highlight about mental status examination later. So Beck's depression inventory, all of you may be aware. There are, how many points are there? Beck's depression inventory? 21. So we have to know this is a depression with a normal intelligence with mild anemia. This type of the diagnosis helps us, by which we can manage in a better way. So definitely depression is the, worldwide it is increasing. Recurrence rate is more, many times continue in adulthood if you don't take care. Poor psychosocial outcome, academic performance, multiple risk factors, comorbidities are there. The incidence mentioned is 4 to 8%. Maybe there may be overlap of many conditions. And they say that female to male ratio is 1 to 2. So there are certain guidelines are given. So that is DSM-5. All of you should know that is a gold standard. Whatever we talk, DSM-5 is the gold standard. So depressed mood, lot of interest, significant unintentional weight loss, sleep disturbances, psychomotor changes, fatigue, sense of worthlessness, impaired ability to think, recurrent thoughts of death, that is a suicidal ideation. So many times we get depressed because of so many things. We don't call depression. So please remember, when you label it, out of this 5 should be there lasting for more than 2 weeks. So this is there. This is a very important thing. we should do patient health questionnaire. It is not for a diagnosis, not to judge the severity, but this is a screening thing which can be done very easily. And maybe last 2 weeks, often have you been bothered about the following problem? There are questions. Once if you feel the score is more than 3, move to patient health questionnaire 9, and there is a modified for teens is there. So these things are available everywhere. Just I want you to know that these things are existing, and depending on that score we can plan. See, apart from this, many times adolescent specialists, we are having a worry of medical legal problem. Up to what extent we can go? This will define up to what extent we can go. So Bake's depression inventory, this is the real great tool. I think MKC sir always talks about this tool, that everyone should do it. Teen screen questionnaire mental health. I think it is a Trivandrum only it is done, but we don't write it, but it is done by MKC sir and Trivandrum, and it is a great thing that we can diagnose many things, and it is a very sensitive test, very simple, and you can diagnose many conditions in this. So next, I just talked about depression. Next, definitely I have to talk about suicide and self-harm, because suicide risk factor happens due to unidentified, untreated mental disorder. It is a complex, multidimensional. It may be genetic, biological, psychological, environmental, poor coping skills, impulsive behavior, risk-taking behavior, all may be contributing. The incidence is very high. India has the highest number of adolescent suicides. Every hour one student commits suicide. Student comprise almost 6.54% of those committed suicide. That is a, but I think now the incidence is more. And we know the common causes in our country: family problem, physical, mental illness, school failure, broken love affairs, drugs, sexual abuse. So we should know about these things. So I want to emphasize, suicide attempts far exceed the number of suicides. For every recorded suicide, there are 20 suicide attempts and 10% succeed. So signs of suicidal ideations we should know. That is very important, by which we can save the precious lives. Then identifying the self-harm. Non-suicidal self-injury. There is a cry for help to relieve the stress, anxiety. They may not have an intention of ending their life, but there is a chance of having a suicidal risk. It is a feature of a personality disorder. And by counseling here we can do. This is not a suicidal ideation. So how to recognize that there will be cut on the other hand of the dominant hand, or there may be bruises, there may be burns, but it doesn't happen. They may take some drugs also, but that doesn't cause a death. I think all the adolescent specialists know warning signs of suicide is pathworm. Is pathworm knows it is an emergency mental health referral is needed if there is immediate threat to life. The moment they say suicidal ideation, first thing is emergency. We cannot go on providing psychological first aid. Here it is referred to psychiatrists. So there is a suicide screening questionnaire. 4 questions are there. It is written everything in that. If the patient answers yes to any of the questions or refuses, then go to the 5th question, and how to work out is there. Now, this is a common scenario we are seeing in the metros. A girl, 13 years old, middle class, concerned family, average in studies, but complaining of lot of psychosomatic symptoms like parents and grandparents worried. She started missing the school from 6 months, and all the investigation, CT scan, MRI, everything done. Birth history, developmental history, family history, nothing. There was a poor school performance of recent onset. And obviously, the change in school nowadays, they are putting in the school with integrated system. They go morning 7:30, come back at 6:37. They are very stressed. Every 15 there is an exam for NEET preparation, GRE preparation, then JE, and then so many preparation they start from 8th standard. So they develop anxiety. This is anxiety, and this causes lot of problems. This is a case I think we all have seen after COVID. A boy comes to you and he's very scared to go out and feels always sad. And he's always watching the news and reading the newspapers. That he has read somewhere that there is a doom going to happen. Earth is not going to be there. There won't be a world. And he has seen his uncle dying in the flood. It's a post-traumatic stress disorder. But there is a new entity. Please remember climate anxiety. solastalgia. It is a new entity and we are seeing a loss for which you need a climate resilience also. So these are the things which we have to know. And about the anxiety disorder, anxiety is common physiological response for any threatening or dangerous situation. But if it becomes interferes with social activities, development, achievement of goals or quality of life, definitely it becomes a pathological. Incidence is 5 to 18%. They say anxiety is the commonest mental health disorder we encounter, but depression is also there. And they present with the symptoms. I think broadly I am telling there is a general anxiety disorder. In this, there is no any proper any situation or any event. They are already anxious for everything. That is a generalized anxiety disorder. Phobias are common, panic disorders are there, separation anxiety is common up to 3 years, social anxiety, situational anxiety, post-traumatic stress disorder. I am very sure after COVID we have seen a lot. OCD, I have seen a girl continuously washing hands and feet, very good in studies. So study and this doesn't go. They may be highly intelligent also, but we have to recognize this. Don't go on telling, and she started getting triggered after COVID because we were telling washing hands. And that time she was 14 years old. And that time it manifested. Now she is doing well and we know the causes. We have to ask family history, maternal over involvement, they say. Genetic, temperamental, environmental. So, what is a generalized anxiety disorder we should know? We should not go on labeling as an anxiety disorder. Use this tool, screening tool, generalized anxiety disorder questionnaire. And total score for 7-item range, I think depends how you do it in a very sensitive way. Now this is a scare. It is a child and parent version. It is a little difficult, but this score of that, I think all of you know this, what is the screening tool. The different score, it is very sensitive. You can decide what type of anxiety disorder it is. Maybe a little time consuming, but a person or a pediatrician who is interested can go ahead and do it. So now this is a girl, I am not going into detail, a girl 14 years brought by her parents for falling of the school grade. Most of them come with that, they don't tell correctly what is happening, we have to take it in the history. Bright student, good in extracurricular activities but complaining all headache, abdominal pain. As usual in metros, they all gastroenterologists, everything they finish, and then later on some pediatrician says go to them, they will correctly do the then heads evaluation done, and it was a mobile and internet addiction, and she was given a latest smartphone by the parents for communication, but she was hooked with the net, and this was a social media addiction. So for that also we have got one problematic and risky internet use screening scale. It is done in Nimans. There are certain screening questions are there, and it is mainly for the adolescent. But apart from that, all of us we know about Kimberley Young internet addiction scale, but that is for everyone. So which has to be used has to be decided, and what is the score. All these things, if you keep the matter on your consultation room table, it is easy to understand. This smartphone addiction scale is done very well. There are 33 questions, but shortened version is there. Only 10 questions. You get a lot of information. Why the cutoff is 31 for boys and 33 for girls, I don't know. That I think experts should tell us, because that is written. So important thing, they just come for body image issue. We all of us know that body image. It's a mental picture of our body, thoughts, belief, feeling, emotions. That time when you are getting that, don't go on asking them close-ended questions. Don't say, are you worried about how you look? They say yes or no. Please ask them open-ended questions. This is a very important thing to remember. So this is a 6th case. I'm not going to go in detail. A boy is brought 15 years old, regular patient, high-colored urine, and feeling drowsy from 3 days, mild cough, and investigation showed as a hepatitis. But he was so drowsy and disoriented, jittery. It did not fit in the hepatitis diagnosis. And the doctor was very vigilant. He could see the injection marks, track marks we say, on the hand. And that was a substance abuse with LSD. I think there are so many LSD are available, like now stamp, they put it on the tongue and they take it, not injection also. It has happened like this because I am from Bangalore. I know the small stamp-like thing that is LSD. They put on the tongue. I think recent workshop, Dr. Newton has presented that. So because of the dysfunctional family, he had this. But luckily, he had some good points. These are the injection marks. So they also have become wise. They are using in a different way. So we should know what is a substance abuse. It is a use of chemical substances in order to achieve alteration in psychological functioning. So these things, red flag signs of drug abuse, we have to know, and it is very simple. If you go on reading, one or two reading, you remember all these points. And for that you screen, do brief intervention and refer for the multi thing. So because it cannot be single doctor cannot treat. The team of doctors have to treat. So there are some screening to brief intervention. In the past year, how many times have you used? I'm just telling you because these are not very difficult to use if you take a printout and keep in one file. If somebody comes, if you don't ask the history, you are not going to know. If you ask the history, you know that this thing happens. So how are you going to diagnose mild, moderate, severe? Never. Usually we give anticipatory guidance. Then once or twice we go on telling appreciate them and tell what will happen later. Monthly and weekly, definitely moderate to severe, you have to refer. So there are craft questionnaire is there, and that we should know. So always there is a, when they come to us, is it a normative or pathological? I am very sure. When they go on telling he is fighting with me, he is taking a mobile, he is doing that, she is going out with a boyfriend, we get worried whether it is a normal or abnormal. So whether it is a rebellious normal behavior where we have to not to do much apart from counseling, or we have to evaluate. Here the useful tools are there. Screening tools. If you are genuinely interested in their well-being, these tools, I think heads, all of us we know. Adolescent stress scale, that is not very specific and sensitive, so I have not added that. Already for depression I have discussed, for anxiety, suicidal screening questionnaire, substance use disorder, media addiction, already I have discussed. Heads is an integral part of our adolescent assessment. This DSM, latest version we should, that is a gold standard, that we should never forget because all the things are mentioned in that. So let us come to the mental status examination. With psychosocial history, mental status examination is the most important diagnostic tool. It doesn't happen like a heads when they sit in our exam lounge, our waiting area. How they are behaving, how are they behaving with their parents or our receptionists, how is their interaction with the surrounding. See, it is unstructured interviewing by their activities. We can, mental status examination is by our observation, the time they enter in our room. No need to ask the questions, you can make out how is their appearance, whether they are well groomed, they are badly smelling, or there is no eye contact. Their behavior also tells. If they are restless, they will be tapping the feet, they will be fidgety. Anxiety, they want to get out. Mood and affect. Mood is what they say, like I am sad, I am happy, but affect is what we interpret. That is more important because many times they may not be able to tell correctly. And the speech, the volume, quality, flow, vocabulary, relevance, prosody. Prosody is a very important. When they speak, their emotions are displayed in. They fast speak when they are very anxious. So their speech also tells a lot of things. Unless our brain knows, our eyes will not see these things. Thoughts could be repetitive. We can diagnose OCD or maybe psychosis like a schizophrenia by observing these things. Their perception, definitely illusion, hallucinations. Cognition, definitely we have to know, because if the cognitive capacity is low, their orientation, alertness, attention, concentration, these things are very important. They say abstract thinking, not reasoning. They should know what are the similarities. See, by adolescent age group, abstract thinking should start properly. It should not be concrete thinking. Then definitely you should be alarmed. And very important thing, should not go on fighting with them. They should have good insight and judgment about their own conditions. Once they accept that, it is easy for us to treat. So this is a adolescent stress screening. So dealing with psychopathology. I'm not telling mental health disorder. Always we say pathology. So let us tell psychopathology. We should take proper family, perinatal, developmental history. Head should be taken, mental status examination, clinical impression, basic screening tool, TS screening questionnaire for mental health disorder, information from multiple sources, not only family, school, community, neighbors, functional impairment, must for the diagnosis, office friendly tools I have told. There are many other tools are there which we don't need to go into details, and help in planning treatment and evaluating response. Definitely DSM-5 is the gold standard for diagnosing. Timely team, multidisciplinary team is very important. But red flags and need for referral has to be understood. All the mental health disorders are not under our purview. So if there is a suicidal tendency, psychotic symptoms, no parental supervision, they may be juvenile delinquent, orphan, definitely we have to refer. And if there are problems in the multiple areas like school, social, family, comorbid conditions, if there is any abuse, immediately we should refer. So let us not confuse with guidance, counseling and psychotherapy. Psychotherapy is provided by a therapist. Counseling is a professional advice. It is not guiding, giving a good option. Suggest them and then they will offer. Guidance is definitely, we tell for career guidance and all those things. So there are types of psychotherapy. So without going into detail, I just want to put self-counseling, it's a philosophical concept or spiritual concept. If we can master reading, writing and arithmetic, why can't we master our own psychological makeup too? That should start from the childhood, in the schools. So this self-counseling, because we don't have many people available. So this will also help. This is a very important thing, principles of motivational interviewing. It is we should never have that judgmental attitude, should have empathy. Don't go on fighting with them. There will be resistance, will be there, they will not accept. And improve their self-efficacy. Don't discourage them. Don't go on resisting them. So there is one more thing is there, apart from cognitive behavioral therapy, we talk about rational emotional behavioral therapy, which we can do into office practice. There is a little difference which we can do in office practice, which requires a separate discussion. So what is the role of different, this is the end, role of different stakeholders in identification of adolescents at risk. All primary care physician level, including MBBS doctor, general practitioners, school level, government level, community level is very important, because if we tell primary care physicians, if you train them, they will recognize the red flag signs, should be able to provide the anticipatory guidance and refer to the mental health profession. School level teachers should be guided. We should do school health program and in there we should teach them. Definitely it will help to recognize the red flag signs if you train them. Government level, already RKSK is making attempt, but still more attempt is required. And responsible social media, because irrelevantly so many things are happening on the social media, we don't have control on that. And the stars or sports people who are doing that advertisements, really, which is detrimental to the society, has to be understood. So I come to the end of the things. Early identification of adolescent at the potential risk of mental health issue and its timely intervention is very important. Healthcare professionals should be involved, who are involved in the care of children and adolescents. There is nothing adolescent medicine, everybody has to get involved. Red flag signs have to be recognized. School teachers and counselors should be given training and appropriate measures can be taken. So we can utilize this platform to promote, protect and restore the mental health. Teachers will be really a great resource for us if you try to tell them. So different stakeholders, government, corporates, policymakers, healthcare professionals should come together and work in collaboration for identification and early intervention. So make mental health a priority. See, I think if anybody has gone abroad, you can see there are posters are put that there is a helpline number. If you have got any mental health problem or you are hooked on the drugs, contact that number. We don't have many helpline numbers. Somebody is committing suicide, we know that person is committing suicide and he is from somewhere far away. We have lost some children because of that. because we could not reach, because we don't have helpline numbers. So some people can reach there and then stop them from doing. So mental health should be the global priority. It is very important for us, and thank you very much for giving opportunity to express. Just I wanted to sensitize. I am not an expert in mental health disorder, but I am concerned about the health of the child, not only physical health but mental health also, which definitely mental health gets affected, physical health also gets affected. So thank you very much.
Yeah, thank you, Madam Geeta Patil. For the want of time, we will allow only one question, please. Madam, please come here.
Yes, sir.
Thank you, madam, for enlightening on the important topic, empowering the adolescents do mental status examination. As a practitioner, we suffer most of the problems like anxiety, stress, depression. They are in the iceberg. But if you identify early in our OPD, so there will be a relationship, but you will have to identify the red flag sign. That is very important, and we can refer. So mental health status examination is very important for the for empowering the adolescents. Thank you, madam.
Yeah, we have got National President Khatkar. I think Madam has said that you have to include this in your action plan. I think I will request Dr. Khatkar to say in his speech when we do inauguration and installation. Over to.
Thank you very much. I would like to present a rosebuds to Dr. Bodankar sir. For chairing this session. Now we take a 5 minutes break and meet again for the installation ceremony. Thank you.